Welcome back to Talk of the Town. Grant Cully, owner of Harbour Health Insurance Solutions, a WHHI-TV health partner, joins us today to continue on the topic of healthcare reform, discussing individual subsidy and mandate. Grant, always a pleasure.
Thank you, Sandy. Good to be here.
Healthcare reform, broad topic, lots going on, lots of changes, just like you said, daily changes. So our last show we discussed exchanges and advantages of healthcare reform. One advantage was the affordability. So who will receive subsidy to purchase the health insurance?
Individuals can qualify for subsidy if their income is between 133% up to 400% of poverty level. That for an individual is about $14,000 a year at the minimum, up to about $44,000 a year. Now, the individuals cannot be eligible for any other governmental assisted program like Medicaid or Children's Health Insurance Plan, nor can they be eligible for an employer-sponsored plan, which would be affordable. And the definition of affordable is 9.5% of your income.
Okay. Wow, a lot of percentages, a lot of numbers. I mean, it's really a lot to really understand.
Mm-hmm.
So, how will those individuals that qualify for subsidy, how will they obtain it?
Well, first they have to go through the federal exchange to apply. And when they're applying, they will see whether or not they are qualified for subsidy. Once they make their decisions on which plan to select, the insurance company that they select will be subsidized by the federal government automatically. They will receive whatever subsidy directly from the exchanges, and then the individual will be responsible for the remainder of the money.
Of that money. So how will those individuals require, I guess basically, will they be required to purchase insurance in 2014?
The majority of all legal citizens of the United States will be required to purchase health insurance in 2014 or be subject to a penalty. There are a few exceptions.
And so what are those penalties?
Those penalties in 2014 are $95 or 1% of your income, whichever is greater. In 2015, it will be $325 or up to 2% of your income. And in 2016, it'll be $695 or 2.5% of your income.
So am I to understand, and I apologize for interrupting you, but am I to understand that that is a yearly charge? Is that correct?
That's correct. That's correct. For instance, let's say an individual makes $50,000 and they don't qualify for any subsidy. What will happen is if they elect not to take health insurance benefits, two things happen. They won't have any health insurance, so all of their medical expenses will be out of pocket. And then secondly, they will be subject to a penalty of $95 or 1% of their income. Since they're making $50,000 a year, 1% of their income is the greater or $500 penalty.
Okay. All right. Wow. So you really, at this point, don't have a choice in 2014 except to take insurance on?
Mostly, yes. There's about 2% of the total population that would be exempt.
And what is an exemption?
An exemption would be maybe certain religious organizations, such as Amish, that don't pay Social Security or Medicare taxes. They would be exempt.
Interesting.
There is a healthcare sharing ministries where people pay shares to their ministry for health care. They are exempt. Okay. Some Native Americans, those who are imprisoned, and the government also has some stipulations for people with financial difficulties and hardships, but they'll be very hard to qualify for that.
So what are the pitfalls in receiving subsidy?
The pitfalls are in 2014, you're going to be going by your 2012 or 2013 income. And you're going to be able to see if you are eligible for subsidy. And if you are, you may make more money in 2014 than you expected and have to pay a refund. Another pitfall is the application's about 21 pages long. You have to disclose all of your income, all of your records. It's almost like filling out a tax statement.
Wow. So if people have questions, they can call, obviously, Harbour Health Solutions, and you guys will direct them in the right answers?
Yes, they can. And I would suggest once this time comes, which is coming up very quickly, they start calling and asking questions on what they're going to have to do, because there are several options and we can guide them through those options.
Grant, thank you as always.
Thank you, Sandy.
And we'll be right back with Talk of the Town.